Sure, sure. So I started here as an intern. There was no Clinic First, no mention of Clinic First. And so I got the opportunity to really have a good pre and post sort of experience with it. And prior to Clinic First, the typical model was you're going to go to your rotation for 4 weeks. While you're on that rotation, you could be pulled in a lot of different directions. So you could be having a clinic that you need to attend. The more clinics, the more advanced you are as a resident. So, first, second, third year, the more clinics you would have. So if you're a third year on a rotation, say pulmonology, you could potentially have up to 4 half days of clinic in a week, sometimes 5. And so you can see how that could be very taxing, as far as, time constraints. You might not be able to fully maximize your rotation. And, I think residents still got a good experience, but I think there was a lot of room for improvement. And so coming from second year, where we did the model where you had 3 or 4 half days of clinic a week and weren't at your rotation, as much as optimal, going to Clinic First, I think was a huge benefit. Bit of a change at first, bit of an adjustment, but I think it was a huge benefit because now I can focus on my rotation for 2 weeks at a time. And so I'm on geriatrics right now. And so I had the opportunity to go to multiple nursing homes versus before my clinic would typically be in a month. So I got to see care in different settings, not just the hospital, where am I attending rounds, but I also got to see her management in the nursing home and in group homes as well, because I just had more opportunity, more time at my rotation. So I think learning is a lot better in Clinic First. I think you're able to see patients in different settings, manage patients differently, and overall absorb more in your rotation when it comes to Clinic First. And I think from the feedback I've gotten from staff and from other residents as well, I think it's also been an overall benefit in clinic as well, because you're in clinic for much more than the 2 weeks that you're off your rotation, but you get to communicate with your nurses more efficiently. You see them day in and day out. I think there's better patient care and overall patient satisfaction even, with Clinic First model, because we can simply just respond to our tasks faster. We just respond to nurses faster. So I think overall, continuity of care is improved as well with Clinic First.